Welcome to Medical Monday with Summit Medical Group. I'm Dr. John Hurley, Summit Medical Group board-certified orthopedic surgeon specializing in sports injuries of the knee and shoulder. Perhaps you have severely damaged your knee and injured your articular cartilage and worry that you might develop early arthritis. A new therapy, articular cartilage resurfacing, is an alternative that may alleviate those worries and allow you to have a more functional knee. Articular cartilage is the protective lining of the joint. You think of our joints or our bones like 4x4s. The articular cartilage covers the end of that 4x4, making it a very smooth surface, which allows our joints to move frictionlessly. Resurfacing is trying to restore the chondroprotective covering of the joint. The chondroprotective covering, which is the articular cartilage, gets knocked off via some type of trauma. When the trauma occurs, there's a shear force across the joint that knocks the articular cartilage off, exposing the bone. And the bone creates a tremendous amount of friction when it rubs against the other surfaces of the bone, therefore predisposing that person to arthritic changes. There are different types of articular cartilage resurfacing, and each type depends on the size of the lesion involved. The first articular cartilage choice is what's called an osteochondral transplant, where we take the patient's own cells and we replace it into the area where it's been knocked off. The second type of articular cartilage resurfacing is microfractures. The microfracture is a matter of making multiple holes in the area of the defect. And what the body does is bring the stem cells down from the marrow of the bone and forms a new protective covering. The third type is called the autologous chondrocyte transplantation, where we take the patient's own cells, we harvest them, we grow them, and then 6 weeks later, we reimplant them. Younger patients are excellent candidates because the purpose of the articular cartilage resurfacing is to protect that joint from developing arthritis. If a patient has significant arthritis, then they're not as good a candidate for articular cartilage resurfacing. But if they only have a defect on one side of the joint, then they become excellent candidates for one of the three procedures that we talked about before. This has been your Medical Monday with Summit Medical Group. Thanks for watching. Summit Medical Group is here to help you live well and stay well.